Welcome to the Self-Improvement Show. I'm Rowan Burckhardt, and we're here with Dr. Brett Deacon, and we're here to talk about your area of expertise, anxiety disorders, and how to help people who are struggling with anxiety. So thank you very much for coming on the show, and look forward to chatting a bit more about your expertise.
Thank you. It's a pleasure to be here.
Yeah. So I thought to start with is be a good place just to get a bit of an idea of your background, your position, what you work as, what your perhaps how you would describe your own area of expertise. And so if you want to just say a little bit about kind of who you are and what you do.
Sure. It's becoming increasingly complicated to say that briefly because my career has taken some interesting twists and turns. But long story short, I'm an expert in exposure therapy for anxiety. That's been the major area that I've focused on in my career, both as a researcher and as a trainer and as a therapist. And I have recently elected to change my career from being a professor in a university environment instead to focusing on getting this very effective therapy out there in the hands of people who need it. And that includes both people who are suffering from anxiety and the therapists who are in a position to help them. And that's going to be the thrust of the rest of my career. And on that note, I'm a registered psychologist in Australia and also in the United States. And I'll be traveling back and forth and trying to fight this battle on both fronts.
Terrific. Thank you. You use the word anxiety a lot, and I actually think that might be a great place to start. Everyone uses that word, like everyone knows what it means and what it is. But let's begin by actually unpacking a bit. What is anxiety? Can you talk about this phenomena that we kind of all assume that everyone else understands? Can you say a little bit about what anxiety actually is?
That is a very good question, and there's more than meets the eye to answer that. Mm-hmm. We all use this term thinking that we're all referring to the same thing, but I think often we might not be. So for starters, anxiety is an emotion. Mm-hmm. It is a response to a perceived threat. Anxiety is life-saving if we are actually in danger. So this is an evolutionarily adaptive alarm system that we all come born with, and it's sort of programmed to go off when we detect a threat. But we don't always accurately detect threat. Sometimes we over-predict threat or imagine that there's a threat when it's not there. And so essentially we can have true alarms and false alarms. But you absolutely want to be able to have a true alarm if you're actually in danger. So anxiety can be very adaptive and even life-saving. It's an emotional experience, but it's sort of changed over time to become a thing that a person has, like a tumor. I have anxiety, and it's taken on more the connotation of a disorder, an illness, a thing that you suffer from. That I think the sort of assumption is, well, you're not meant to have it. If it's there's something wrong, and you are meant to have anxiety, but ideally it's only meant to go off in response to an actual threat.
It's really interesting that you talk about that there is like false alarms and true alarms, and that it can be a bodily response to a real danger. Because when I work clinically with people and we sort of touch on struggles with anxiety or feelings of anxiety, that's one of the first things that I'll actually explore with them, is to try to understand, is something that they're facing actually a real danger? And I think it's really important to separate what might be, in a way, an over, a too sensitive alarm, or an alarm that's kind of smelt a whiff of smoke, but actually there's no fire, versus there really is a fire in the kitchen. So I think that's a really nice thing to recognize. And I think that's sometimes even lacking, where people, they may not even acknowledge that there is some anxiety that is a really adaptive response to this sort of threatening situation they're in, versus someone who might have an overreactive kind of fight or flight system. I might actually circle back to that though, because there was one more thing that I'd like to perhaps clarify or ask about before we kind of go further down that rabbit hole. And that is, what is actually an emotion? Because as you say, anxiety is an emotion. And again, I feel like we use this word quite easily, and there's always this assumed a sense that the person will know what an emotion is. But can you say a little bit about what actually is an emotion?
Yes, I can. But really quick before I answer that, I want to come back to your very good point, which needs to be, I think, re-emphasized, which is sometimes anxiety occurs in response to an actual threat. And if that's the case, the last thing you would want to do would be to ignore it and try to make the anxiety go away. You would want to deal with the threat.
Yeah.
Yeah, I mean, you're a couples therapist, right? And you work with clients who are probably sometimes anxious about their relationship, maybe for very good reason. So coming back to the emotion, emotions are psychological responses. They don't just fall out of the sky and occur for no reason, but they tend to be responses to particular contexts. So, for example, anger is what you would feel in response to a perceived injustice. Sadness is what you would feel in response to a perceived loss. Anxiety, perceived threat. Mm-hmm. And in each of these cases, these basic emotions we have, they serve a purpose. They have meaning. And they play out in terms of how we feel, the sensations in our body, the behavioral tendencies that go with them. So for anxiety, it's avoidance and escape that are the natural inclination that we feel when we're anxious. But a central point here is that emotions have meaning. Mm-hmm. And if you're having an emotional experience, it's worth having a deep look at where it's coming from, because there's probably an important story there. Yeah. And if we instead think about anxiety as a disorder, something that's not meant to be there in the natural state of a healthy, happy person, then we're missing a very important aspect of that experience.
Yeah.
That a good therapy would focus on exploring and understanding.
Yeah. And that's I think really important to recognize is there is a trigger for the emotion, and that needs to be taken into account. So it's the body or the brain's kind of way of responding to a particular event or incident. You talked about how I'm just going to go circle back to this sort of idea of it's a psychological phenomena, and it's been sort of labeled as this sort of problematic kind of response to something, but you do need to consider the cause of it. Perhaps to say a little bit more about this idea of the importance of the trigger and what that trigger can be and how that fits into then the experience of emotions is one thing that I'd like to sort of talk about. Again, I'm kind of making these mental notes about things that I want to sort of circle back to, but I'd actually like to continue on this sort of idea of what is anxiety, what is an emotion, and the thing that I want to sort of stay with for a little bit longer is it seems like a lot of people may not even be aware of their emotions. So I'm not sure if that's been your experience working clinically, but I've certainly noticed that half the work with someone can be to actually have them recognize that why they're reacting as they do and having the struggles that they're having is actually because of this invisible phenomena called, say, for example, anxiety. And so many people are not even aware that they're scared of something. So I'm not sure if that's an area where you've noticed or that has been part of your work, but before we go on to those other things of the causes and the triggers and a disorder versus a healthy reaction to a danger, is there anything that you can say about the unawareness aspect that a lot of people may be experiencing when they're dealing with what actually turns out to be an anxiety problem?
Sure. My first thought would be the people I work with have no trouble being aware of their acute, obvious, very high anxiety. So that it's not a mystery that they're experiencing it. Generally speaking, with the people I work with who tend to have more issues around OCD, social anxiety, panic attacks, that sort of thing.
Right.
I will say that in coming back to what you said about anxiety having a trigger, sometimes the trigger is obvious, like a traumatic event that happens to you. Sometimes it's subtle, and sometimes a lot of time has passed since the original bad thing happened that made you respond with anxiety. And so for example, if I have a relative, God forbid, die of cancer, who's around my same age and who was healthy, as far as I knew, that might trigger anxiety that I could suffer the same fate. And that anxiety might be acute and obviously related to what happened to my relative in the early days. But over time, as that event fades into the past, it might stay with me in a general sense of unease, but it might be harder to relate it to that trigger because its salience has faded over time. But that's the source of it if we were to go back in time and connect the dots. But I might not be as aware that I'm feeling anxious. I might just have a sense of unease.
So there's kind of two things of awareness that we need, right? We need to understand that we're feeling anxiety and that it's fear and that's the emotion. And we have to have some awareness of what the trigger is. And what you're saying is that a lot of the clients that you've helped have actually come in going, I do know I have anxiety, but you've seen more of the unawareness of the trigger, if I understand that right.
Yeah, the clients I work with are aware that they have anxiety.
Okay.
But yeah, sometimes the trigger is less obvious. But there's a backstory. There's always it doesn't just, like I said, fall out of the sky. There's a reason it's there.
Yeah.
And investigating that backstory and the person's life experience and the meaning they made of it is an important part of understanding the nature of anxiety.
Right. Okay. And I think maybe what you've seen in your clinical work is different from mine in the sense that it sounds like you've worked a lot in like an anxiety clinic, or you've sort of promoted yourself as an anxiety expert. So people are coming to you already clearly, probably with a diagnosis, probably with different sort of attempts at dealing with it.
You're right.
Right. So because when I work with people, I might be touching on a reaction they're having to their partner, and they've got no idea that it's because of the fear that the partner will leave them or not like them. So part of my work is actually uncovering and helping them realize that they're feeling anxiety because of that. So that's maybe where the difference is that it's just the people that you work with have already got a long history with knowing that what their struggle is anxiety.
Yeah, I'm the guy people come to for help with an anxiety problem that they have acknowledged. So you're right. It's probably different groups.
Yeah. Okay. So you get people who self-identify, and I suppose it's even just a comment that I'm kind of making in thinking that for some people, where they're at in the journey might be before they get to see someone like you, where they've got this pattern of behavior which they don't really understand why they're doing it. Like, I think a lot of people, say with social anxiety, that they don't really understand that they got social anxiety. All they know is that they don't like big groups, or they don't like being the center of attention, or they feel a bit uncomfortable with certain people, and they haven't actually kind of recognize it as social anxiety. And so perhaps a lot of people do go through that period of not knowing, and eventually they get a diagnosis, or they research, or they see someone, and that person for the first time in life says, oh, you've got OCD, it's an anxiety disorder, or you have social anxiety. So perhaps that processing or that change in their mindset has happened often before they've actually come to see you.
I think that's probably true in many cases. In some cases, it's not. I've met plenty of people who didn't come in with a diagnosed anxiety disorder, but did just have some areas of discomfort. And I think what can be really helpful there is, two different ways for understanding the nature of an issue. One is to diagnose it. Another, which I think is more informative, is to formulate it by linking the person's experience to what's happening in their life, what's happened in the past, the meaning they made of it, the triggers, the patterns of general behavior. And that's, I think, more helpful in understanding exactly why a person might be uncomfortable in groups, for example. And I can say you have social anxiety disorder, but that doesn't really add much to what we already knew, which is that they're socially uncomfortable, right? If you really want to add to it, you have to explain why it's happening, and a diagnosis doesn't do that.
So perhaps that kind of the language that you use is less important, but it does sound like you do need to help the person realize that this pattern is linked to some kind of uncomfortableness. And that's perhaps something that most of the people you work with have already gotten to that understanding, but occasionally it sounds like you might need to help that person become aware that, because I suppose, and the reason I'm asking this, I'm just thinking that for a lot of people, what they see is either their behavior and they see patterns and they don't really understand the cause. So someone who doesn't like to go out of the house very often, I had a friend recently ring me up and sort of talk to me as like, Rowan, I'd like your help. I know that you're a psychologist. And he talked to me about this issue, and he talked about how he just gets really uncomfortable leaving the house. And he talked about all of these perceptions of like, he was in French, it was a French friend, and he talked about like vertigo, which is like a dizziness kind of feeling. And he talked about how his life has become restricted, and he talked about how some places he could go to he felt okay, but others he didn't. And he just didn't understand. He had no sense. And he's a really emotionally aware guy, but it's never been brought to his attention that what he feels as what he sees as avoidance and what he feels as a kind of the dizziness is actually anxiety. So it seems like for a lot of people, what they might observe more is they hate going to work. They take the long path to get somewhere. They don't accept invitations to go to social events. So is that something that I suppose is been something you observed, and not just in your work, but just generally in your experience in the world with people and their struggles with all differing degrees of anxiety?
The thing being observed being that people don't seem to have a good awareness that what they're experiencing is actually anxiety. Yeah, I certainly observe that. I guess there's a continuum of kind of insight into understanding the nature of one's experience and why you're feeling the way you are, and how to link that to triggers and concerns. And some people are better than others at that. But that's part of, I think, our job as therapists is to help people put those dots together. And I do want to come back to something you said a few minutes ago, which was a comment about wording not necessarily being that important. I actually place a lot of importance on the vocabulary that we use around anxiety. And here are two examples where I would interject to try to help a person use vocabulary that I think is more helpful. If someone says, I have anxiety, I want to change that to, I'm feeling anxious, which reinforces the idea that it's just an emotional experience, and emotions are fleeting and there's nothing wrong with them. Whereas if you have it, it sounds more pathological. Right? And also, I can't. I like to change that to I won't. And often in therapy, I'm encouraging people to do difficult things, like face a difficult situation. And if they say I can't, well, that's not actually true. You can choose to if you wish to, and I wish to support you in making that choice. And I would rather hear you say, I won't, because now you're acknowledging that you're just choosing not to. And then we can have a conversation around that. But if you say, I can't, you're saying that you don't have the resilience for it, that you lack the capacity to tolerate the distress. And I'm thinking, no, you can do this. I know it's going to be hard, but you have the capacity to handle it. And I don't want to use language that reinforces the idea that you don't.
Yep. Okay, good. Having talked a bit about kind of this experience of anxiety and how for some people they're quite aware of what it is and others perhaps less so, I feel like I'd like to kind of then move into the next step in this process, which is people who might suspect or feel like they have anxiety, and how there can be some which is quite situational or quite specific to a certain problem they're facing or a situation that they're in. So I'm just thinking of, for example, the difference between someone who has a bit of a crappy boss at work and they're getting put down or they're getting micromanaged, and then they become a bit anxious about going to work, right? So that's kind of a behavior that's in response to an anxiety. But that's obviously quite different from someone who has struggled their whole life with, say, social anxiety or OCD or something of that nature. So is there anything that you can kind of say about those different types of anxieties and how they're both anxiety, but they're actually quite different struggles with anxiety?
Sure. Well, I mean, it all depends on the context. So if you have a crappy micromanaging boss and you're anxious in that environment, well, that makes sense. That's probably more of a true alarm. But there might be ways that you are potentially exaggerating the badness of it that are making you more anxious. There might be unhelpful ways of behaving in that situation. So, for example, like leaving the office early, trying to make sure your boss doesn't see you. That might actually unintentionally make things worse and increase your anxiety. So it's still worth looking at the context, the meaning you're making of it, how you are behaving, and how that's all playing out. It's not fundamentally different in that context than it would be for somebody with severe OCD. I mean, the basic building blocks are the same. It's the perception of threat leading to the emotional experience of anxiety, which usually leads to seeking safety, which tends to prevent you from realizing that you're okay, the situation's not as bad as you think. And I mean, you can get locked into that and go very deep with it and you know, have a ruined life as a result. But I think the basic elements are the same. It just depends, like how extensive is the avoidance? To what extent are you predicting threat? You know, like, are you worried you're going to have a heart attack and die if you go to the grocery store because other people are there and they'll make you anxious and you won't be able to tolerate it? Like that, I predict, would lead to a lot more severe avoidance behavior. And next thing you know, you're ordering all of your groceries online because you're not going to the store. Yeah.
And I think what you're saying is starting to help, just as I kind of interpret and listen to your comments, which is that so you can have anxiety relating to a real threat, and then you can have anxiety that's perhaps relating to a real threat, but there's some kind of element of exaggeration or misperception. So it might be, for example, my boss really hates me, or every day at work is awful, and there can be elements of that anxiety kind of feeling and response, which is disproportionate or not fitting with the situation. So we've got kind of real matching anxiety for what you're facing. Someone who's about to get, you know, kind of attacked or hit, they're going to feel anxiety, and there's no misperception there. They're just genuinely responding to a danger. Then you've got the exaggeration, but then you've got the third sort of kind of type, which is where there's a pattern of avoidance and it starts to take on a life of its own, right? And that seems to be like my friend who I was referring to earlier. I talked to him about panic disorder, right? Because it felt like from what he was describing, it fitted quite closely with that. So there might have been an original incident. There might have been some kind of thing that made him avoid going out. But he had fallen into this pattern where he was fearing getting overwhelmed by his anxiety if he were to go into these areas where he wasn't comfortable. So it was starting to take that life of its own, and he'd been struggling with it for several years. So would that be a fair kind of reflection and just sort of summarizing of your comments about how you can have adequate, normal response to a danger, you can have exaggeration and misperceptions, but then you have kind of this third category where avoidance kicks in and it starts to form this clear pattern, which we often use words like OCD or social anxiety or panic disorder. Does that feel...
Yeah, I think that's a fair way of putting it. Again, it's all about the context, and you can break anxiety down into different parts. So like there's the trigger, and then there's the thoughts or concerns about bad things that might happen, and then there's the body sensations. But like, let's take your friend. It's one thing to feel anxious in those situations. It's another thing entirely to avoid them as a result. And that's where people get into trouble. Like, for example, I'm not particularly anxious at the moment, but I've got a few nerves sitting here doing a podcast with you, but I'm not avoiding it. I'm leaning into it. And so, that courageous approach is preventing me from making this worse. And, if I made up an excuse and left, now it's going to be harder for me to ever do another podcast again, because I just sent myself the message that, I can't handle it. It's too hard. So the real problem with anxiety is the paradox of avoidance. People avoid or escape in order to feel better, but it makes things worse over time.
Right.
And if we flip that, we have exposure therapy, which is approach, even though it makes you uncomfortable in the short term, in order to feel better in the longer term.
So I'd love to put a little bookmark on that exposure part, because that's going to be a whole discussion in itself. But just to stay with this idea of avoidance. So as you're talking about it, it makes sense what you're saying, but my mind is just going to how a natural way of responding to danger is the fight or flight. So is the flight, right? Now, how do you differentiate between moving away from something that is a good thing to avoid versus that pattern of avoidance, which then creates these problems that you're talking about?
Well, you should move away from things that are good to avoid, right? So begin by looking at the context and determining how concerned you realistically should be given the nature of the threat.
Okay.
And if there is a legit threat, like you have a terrible boss, then see what you can do to make the situation better.
Okay.
There might be a way of communicating with your boss, or some ways that you can just calm yourself to get through the day. Maybe you need a new job. It depends, but let's have a look at that. I think more what happens with, I guess, the more problematic forms of anxiety is there's not an actual threat there, or there may be a threat, but it has a very low probability of happening. Or it may be just the kind of thing that is inherently uncertain. Like, am I going to die of cancer? I have no idea. But I'm probably best off right now just trying to put that out of my mind and not changing my behavior in response to that concern, unless I'm having like symptoms. So I think part of getting through life well is learning to accept uncertainty and to not get overly caught up, behaviorally speaking, in response to concerns about low probability catastrophes. And that's where anxious people tend to get stuck, is they take them overly seriously and allow it to change their behavior in a way that just locks them into this cycle of concern and avoidance that maintains the concern.
Yeah. And it seems like as you're speaking, it's perhaps becoming clearer to me that what you're sort of referring to in terms of when it becomes a real, and if we want to use the word anxiety disorder or a real problem with anxiety, whatever terminology, but it's where there's a pattern of avoidance. Because firstly, if there's a real danger, getting out of there is a very effective response, right? Someone comes knocking down the door and is angry and aggressive. For you to go, I'm going to get out of here. You don't need to face that 6-foot guy with a baseball bat to avoid having a problem with anxiety. So it can be adequate. But the other thing is, and as you're talking, I'm just thinking there might be times where you avoid, but it's just one-offs. So, for example, you get invited to give the keynote speech to your friend's wedding, and you kind of go, you know what, I don't really want to do that. I mean, how many times do you get asked to give a keynote speech at your friend's wedding? So if it's kind of low level and it's one-offs and it doesn't create a real recurring pattern, even though maybe it would be better to be a bit courageous and to step up and your life would be better as a result, it's not going to kind of bring you to knock on the door of a psychologist like yourself when you've avoided one single be the keynote speaker at the friend's wedding. Yeah. So it sounds like there's something there in terms of when it reaches that level for you to then work with them. Would that be right in saying there's a pattern of avoidance?
I think the pattern of avoidance is really the essence of an anxiety problem over time, anxiety disorder, whatever you want to call it. That's the most problematic part of it.
Yep.
And avoidance can be subtle. You could be distracting yourself while in a feared situation. You could have a few drinks before entering it. You could be praying to God for reassurance. You can be listening to a podcast as a way of getting your mind off of the fact that you're around other people who might be looking at you. So like you can not appear to the outside observer to be avoiding while still avoiding the whole time. And that avoidance can, interestingly enough, be just as unhelpful as overt avoidance.
Yeah. It's really good that you mentioned that, because I think that's something that's so often missed, and it creates the difficulty in identifying these patterns of avoidance, because, as you say, they can appear to not be avoidance, but they are. I had a professor who talked about micro and macro avoidance. So that was just some terminology to refer to the macro being where you just outright don't go to the party, you don't leave the house, whereas micro is you do it, but you always have your pills with you, or you always bring a friend to that party, or you arrive late, or you drink a lot. And I think, like, for example, use of alcohol is a very common form of avoidance that a lot of people don't realize that it's being used in that way.
I completely agree. And I think it is worth repeating the point that there's obvious overt avoidance, the macro avoidance, but there's also the micro, the covert. And often here we're talking more about like lifestyle factors, the way that people habitually have learned to rearrange their life in order to manage their anxiety in ways that make complete sense, but ironically just make it worse over time. And you mentioned a great example, the carrying your pills in your pocket. That can be so problematic. And it's frustrating when I see a client who's been doing that for years, because doctors have told them, when you go to the grocery store, have your Xanax with you. But let's imagine that person in the grocery store with the Xanax in their pocket, worried, let's say they're going to have a panic attack and might need to take it. Well, that alters their mindset. It makes them focus on whether or not they need to take it yet. How do you know? Well, you need to scan your body and determine whether or not you're having any panic symptoms. And so the act of needing to know whether or not to take it is actually making your anxiety worse, because now you're hyper vigilant to threat, and you're going to be more likely to detect it and panic about it and take the pill. If you go into that grocery store without that pill, you know that you just have to suck it up and make it through, and you'll summon your courage, and you'll be more likely to pull it off. So that little subtle behavior, even if you don't take the pill, just knowing it's there can sabotage your opportunity to learn that you can handle being in the grocery store.
I think what you're sort of touching on is one form of that avoidance, which is perhaps a bit under-recognized, and it's the usage of medication as a form of avoidance, or the having it there available as a form of avoidance. Just staying on this sort of topic of like forms of avoidance that are maybe not so apparent, what would be the most common types that you would see in your work when you're actually starting to kind of look for those behaviors of avoidance, but they're being kind of a bit hidden, or they don't look like classic avoidance of just outright avoiding? What would be sort of like 3 or 4 or however many, but like the most common forms of that sort of hidden avoidance?
Sure. Well, obviously it depends on what the person is anxious about, but in the social world, avoiding eye contact, easy to do. Doesn't stand out all that much. But I mean, that would be the sort of expected way of being around other people for someone with high social anxiety. Also, not saying very much, keeping conversations to a minimum. So there's that social avoidance. And in terms of, I guess, other common ones, keeping busy, distracting oneself. The use of alcohol or other drugs, I mean, that's got to be toward the top of the list, I would think. And if you had something bad happen to you and immediately turned to alcohol, the association between the trigger and the response there is pretty obvious. But if you then just make that the way that you live your life every day, that association fades, and now you're just a person who drinks a lot. But there's a reason for it. It's to manage the anxiety that was originally triggered, but that reason can just fade over time. And now what you're left with is an altered way of living your life.
I remember reading somewhere or hearing that alcohol is often used to try to make you or become someone that you're not. Now, this is a bit of a divergence away from sort of classic anxiety disorders that we are sort of talking about, but it's certainly, it feels to me like that's a common form of anxiety, which is someone who's not comfortable with who they really are, and they then use, say, for example, alcohol to try to become someone else, which in a way is an avoidance, right? It's an avoidance of actually being themselves. Is that something that you have seen and recognize?
Yes, well, that's an interesting one because alcohol does change behavior. I mean, I think those of us who have had drinks before, we understand that you might become more relaxed, feel more confident, feel better able to have conversations or, approach someone and ask them out on a date or whatever it might be. Like it does have that effect. And so it's not necessarily anxiety management. Like if I go to a bar and have a couple of drinks because I'm in a good mood and I feel like that's going to, make me more social and have a better time, it might, and that's not anxiety related. But if I'm concerned about being judged by other people and I go there and have those few drinks, chances are my motive for doing that is to reduce my distress in that environment and maybe reduce the probability of getting rejected by other people because I think I'll behave in a more appropriate manner.
Yeah, it must be like probably one of the most common problems is low-level social anxiety. If you look at our society, I mean, how many people would go to a party sober? How many people would go night out on a Friday or Saturday and not touch a drink?
Yeah.
How many relationships are formed because of alcohol? So it's
baked into our culture. Yes, and I mean, we're in Australia. This is one of the cultures in the world where that's just a standard part of social life is drinking together. Yeah, and I'm from another one, the United States. When I go home and visit family and friends, that's what people do.
Let's take, for example, someone who drinks a bit too much as a way to feel comfortable in a party. Is that actually really social anxiety? Is it just a lower level than what you see when you have someone knock on your door and say, I haven't socialized in 10 years. I've got 0 friends. I can't leave the house and meet people. Like, are we talking about the same problem in degrees?
Well, again, I think there's a difference between somebody who is not socially anxious, they're not concerned about being judged or awkward or saying something stupid or whatever the threat might be, and they just want to have a few drinks to have more fun around other people or to be a bit chattier. So the difference I'm making is whether or not there's a perceived threat that they're trying to manage, and I would put it down to that. I would want to know if the person's drinking is linked in their mind to the motivation to mitigate the threat. And there's not always a threat. Sometimes you just want to have fun with friends. But if the motive for the drinking, the intent, is to prevent feared outcomes from happening, then it's more likely to be an anxiety-driven safety behavior.
Let's just say they feel like they wouldn't be as fun if they go out, or they would not really know how to comfortably have an hour worth of conversation without drinking. And so in some ways it is driven by a fear of not being able to hold a conversation for an hour, or fearing that they're not going to be as fun, as sort of jovial as what they should be for that party. You would say that then that is a form of low-level social anxiety.
Yes, I would. And I would also say that if the person is drinking in order to prevent those bad outcomes from happening, then they are unfortunately depriving themselves of the opportunity to find out, in all likelihood, that they didn't need to drink in order for things to turn out okay. And so that's one of the problems with the use of safety behaviors, is they prevent you from learning what would have happened if you didn't use them.
What you're saying is, if someone, for example, felt like they aren't fun enough, and so therefore most of the time when they go out, they drink to make themselves more social and more fun and so forth, then they're not really testing what it would be like to talk about whatever they're interested in and to be themselves, that it is a way of never really testing out if their true self is kind of acceptable to others.
Exactly. And we have a term for that. It would be the misattribution of safety. That would be the idea that the alcohol is the reason why things turned out okay. And so if you go to a party and you're concerned that socially it's not going to go well, and you drink and it turns out okay, the lesson is the alcohol saved me.
Yeah.
As opposed to, hey, maybe I was wrong. Maybe I can do this. If you drink for that reason, that's not the attribution you're likely to make. You're likely to misattribute the fact that nothing bad happened to the power of the alcohol.
That's a massive thing for someone to change, though. Like, if someone feels like, and we're using the word fun, but it could also be that they're boring. I mean, I suppose that's the flip side of fun. But like, I know a lot of people would struggle to really show their true self, reveal who they are, stay in a social situation for several hours. It feels like, as we're talking about this, we're probably talking about 60-70% of the population, if not more, who have some level of discomfort with who they really are.
Well, I think you're right. And I mean, I've read stories from people who were heavy drinkers for a long time and then stopped. And then all of a sudden, they were profoundly bored for the first time in ages. Yeah. And then they had to find something to do. Yeah. And then begins the journey of self-discovery. Yeah. Which, I mean, so flipping that, you can unfortunately be preventing yourself from growing as a human being and finding out who you really are if you're just making it through the day by drinking or other safety behaviors like that, where you're just trying to take the edge off to pass the time.
Yeah, right. So fascinating, because like, in some ways, someone could be thinking that their struggle is drinking and they're drinking a bit too much and they should cut down, but they just might be totally oblivious to this kind of anxiety that is sitting underneath. And it might be not your classic anxiety. Like, because I think I've often thought about anxiety problems being more that OCD or panic disorder or something. But what we're talking about, and I don't even know if the right word is social anxiety or not, but it's that discomfort with who they really are. And it feels like a lot of people are using alcohol to somehow mask that. Then there's the others that maybe are dealing with stress from the day and other reasons. So it's not everybody that drinks a lot would be doing it for that, but at least a significant portion probably. It's some level of not feeling too scared to really be themselves, right?
Yeah, right. I think of this term from acceptance and commitment therapy called experiential avoidance. Which is sort of a broader term that describes any behaviors that we engage in to reduce, control, or eliminate an unwanted internal experience, an unwanted feeling. And it could be insecurity, it could be boredom, it could be loneliness. And a lot of the way many of us live our lives is in the service of experiential avoidance. I mean, all you have to do is have a look around and see how people manage boredom. They're on their phone, as opposed to, being present in the moment, interacting with other people, or doing something a bit more productive. I'm as guilty of this as the next person. But yeah, like it's very easy for us to fall into the trap of experiential avoidance, because unless this is something you deliberately cultivate, we don't like feeling uncomfortable or insecure or bored or lonely or sad or afraid or whatever it might be. Like, the natural human tendency is to want to make that feeling go away. Yeah. And there's so many easy ways of doing it. And drinking and phone are the two easiest ones that come to my mind. Yeah. And they work. Let's be honest. If you want to eliminate your boredom, take out your phone and start watching something on YouTube. Yeah. It works in the short term. Yeah. But if that's how you live your life every day, it's going to kind of keep you stuck. Yeah. There's an idea that I've heard. I haven't really sort of spent too long kind of diving into that sort of Buddhism philosophy, but I remember someone who came back from a week-long retreat of, I think it was Vipassana meditation, and they talked to me about how what they'd really gotten out of that week was how much we as human beings avoid pain and move towards pleasure. And it feels like
there's kind of that's caught up in that same avoiding of, I mean, there is that kind of high level avoidance. There's a pattern. They don't leave the house. But then there is that just natural, we human beings move away from pain, negative emotions. And anxiety is one of those. So there's probably an element where like we as human beings are hardwired to constantly seek ways to minimize that experience of pain and negative experiences such as anxiety.
Spot on. I completely agree with you. And on the hardwired part, like I think a useful concept to introduce here is the idea that we have these two parts of ourselves. You can think of them as the head versus the gut, or you versus your mind. And our minds kind of have a mind of their own. And the mind is, I think, the wired part of us that wants to get rid of bad feelings and move toward things that are pleasurable, even if they're not good for you. Mm-hmm. Your mind is just focused on the now and doesn't know that if you have that 12-pack of beer, you're going to have a hangover in the morning. Your mind doesn't care. And part of like the meditation practice is to learn to live in harmony with your own mind and not to just give in to what it wants to do. And that doesn't come naturally. That's really hard. That takes a lot of discipline. And I think cultivating that discipline is an important part of personal growth.
Yeah.
And I think this is the universal struggle that we all have is to learn to be a master of our own minds and not just give in to these temptations, which are very easy because people don't like feeling bad and they like feeling good.
Yeah.
And there's nothing pathological about that. That's just being a human being.
Yeah.
Yeah.
And that's why I think, and it's so good for us to recognize this, is that something like avoidance or social anxiety, and exists on a continuum from just, it is a normal part of being human, to have a tendency towards shutting down or avoiding or not wanting to feel negative things, through to the person who hasn't socialized in 3 years because of that high level. So there is really a spectrum there. And it's probably when it gets to a certain level that it requires help from a psychologist versus, hey, we're not machines, we're not perfect, and no one in this world exists without any form of avoidance.
Yeah, I agree with you.
Yeah. Brett, one of the things, like, as we're talking about this, I want to just sort of kind of return to this idea of, because we were talking generally about anxiety, but we use the example of social anxiety and that sort of discomfort with being ourself. And as we were talking about it, I had a kind of thought, and I put a little bookmark on it, and I want to come back to it now. What about the people, though? Because I know I've got some friends and people I know who, it's like they are quite different. They're quite unique individuals. And it seems like that uniqueness and that being quite different can then create some kind of, let's call it, incompatibility with I was going to say the general public, it's such a psychology term, but with other people, right? So if, and they now talk about, like I said, things like neurodivergence and whether it's, ADHD or autism or any of those other number of neurodivergent type of brains. But it seems to me, and it's something that I noticed in my work with clients, is that when we explored what was going on below the social anxiety, there often was something about them that they felt was quite different from everyone else. They're really intellectual and all their friends are kind of, into just partying and drugs and alcohol or something, or they have a sort of autistic mind or an ADHD mind, and it creates a difficulty in those social interactions, which then they have a negative experience, which then makes them avoid, and then they sort of develop a social anxiety on the top of that. It's been my observation from my clinical work as well as with friends and people around me. Is that something that you've seen and you've observed, this sort of notion or idea of that it's not just everybody, we're all the same, and some people go on to develop social anxiety, but rather it's more likely to happen with people who are perhaps a bit different from others?
Yeah, that's a really good question. People are different. Like I spent a lot of time thinking about this particular topic. Like I've long ago rejected the concept of normal when applied to what it means to be a human being. And I think part of what we do is and I wish we didn't do this as much. We often, when we're talking about human psychology, we begin with this hypothetical normal person, who has no issues, behaves very well, is very good socially, and then we compare ourselves to that person. But it's not like everybody's like that. We're all different. And this notion of neurodiversity, diversity and variation is just the natural state of a species. So we are different, we are diverse. And I reject the idea that, I'm neurotypical and you're neurodivergent, and therefore you have a different brain than me. There's no scientific evidence for that. That's more like a sociological argument intended to reduce stigma. But I think it once again, just like saying that there are people who are normal and people with mental illness, and that there are two types of humans, and you're one or the other. Saying that there are people who are neurodivergent and there are people who are neurotypical basically does the same thing. And I think we're all just different. And you could take any 10 people that you and I know and put them in a room, and they're going to be major differences in personality traits and ease with sociability and the way people tend to interact with others. And I think that variation is fine. It's just part of the spice of life. But when people are naturally different in ways that make socializing with others a bit awkward for them, that natural difference that they have might actually make the social world more difficult for them than it would be for you and I. And if they respond with avoidance and safety behaviors and not making eye contact and not practicing being around other people, then it can take on a problem of its own. And anecdotally, my observation has been that the socially anxious clients I work with tend to be a bit more shy than the average person. And if you go back in time, chances are they were teased by their classmates for being a bit shy or a bit different, and then reacted to that by thinking that the social world is a dangerous place, and they became more withdrawn and avoidant, which only made things worse in the longer term.
I do hear what you're saying. I suppose this might be actually an area where we have slightly different views, and that's such a nice thing to recognize as well. And we can kind of, perhaps have different perspectives and recognize that we are trying to figure out a really complex phenomena, which is understanding human beings. But I have found in my personal life and with my clients a utility in recognizing that some people do have a bit of a different brain. And I'll use myself. I'll put my hand up as my own sort of personal experience here that I was never formally diagnosed as a child or a young adult, but at some point through my sort of experience in psychology, I sort of read about and came across this idea of ADHD. And it just explained so much for me in my personal life in terms of patterns and how my brain functions. So it's something that was useful for me. And I don't see it as an illness. So that's where we do share the same perspective of it not being that kind of disease model. But it's something that has been useful for me to kind of talk to myself about my ADHD brain, or that's my ADHD, or that's my kind of impulsivity or lack of filter, or all those things that it kind of creates. So I don't know if you were sort of suggesting that you sort of believe that those categories or those concepts are kind of non-existent, or it's more about saying, yes, they are, but I reject the disease and the seeing them as a problem kind of idea. But you're saying yes to the latter.
Yeah, great. Thank you for putting it that way. My question to you would be, why do you use the word brain instead of mind?
I probably use them interchangeably.
Okay. Yeah. So I guess I'm a bit of a stickler for precision when it comes to this. And part of the backstory is for many years I've been interested in what happens inside a person's mind when they're told that their depression or anxiety is caused by a chemical imbalance. And I've studied that. And the answer is a lot happens, and it's not necessarily what you would want. People feel more hopeless, powerless, feel like only medication can help them, that they're fundamentally different from other people because their brain is different. And so I'm sort of sensitive to not conveying that message necessarily to a person. And so when you said you read about ADHD and it fits your own experience, that doesn't tell me there's anything wrong with or different about your brain. What I was hearing you say is that fits your psychological experience, like how your mind tends to work or how you tend to behave, which is separate to your brain. And so what we're talking about is what is the relationship between the mind and the brain. And there's this tendency, which is very easy to get into, which is if there's a problem, perceived problem with your mind, therefore it's your brain's fault. So there's that. And then we have this mountain of neuroimaging research that compares the brains of people with and without ADHD or other diagnoses. And the differences between the two groups are small and clinically meaningless. So that's also part of where I was coming from there. What are your thoughts?
I think that is probably an area where we do differ. I do have a belief about how there are brains that are different. I agree with you that they haven't come out well in terms of imaging and brain scans and things like that. From everything I've seen in the research, it's a really unreliable way to sort of detect that. But for example, I've got a friend who's suffered kind of depression his whole life. I've got a lot of clients who have bipolar. I've got a friend who has autism. And I see these patterns, and they started from such an early age. And, like you'll meet a 60 or 70-year-old man who his whole life he's had bipolar, and it's been ups and downs of mood, and his downs are really low and his ups are really high. So for me, it feels like there is something that is different in that person's brain beyond just language or a pattern of behavior or something. Whether it's easily detectable or not is a whole other thing. And it seems like so far with our use of imaging, it's not. But without sort of, I suppose, entering or allowing this whole discussion to be about whether these are different brains or not, just returning to this sort of idea of anxiety, like I've seen a number of people, for example, that would self-identify as having autism, and they often are quite socially anxious. And it seems like there's something about that sort of tendency towards autism, which then makes them feel uncomfortable in social situations. Is that something that you have noticed? I mean, you talked about bullying as being one example, but whatever word we want to use, and whether we kind of put it down to a brain difference or a mind difference, but would you say that I don't know, autism, bullying, all of those things can be part of what has created that? I suppose actually bullying is more of an experience, but if we take autism, would you say that people with autism would be then more likely to have social anxiety?
Trying to organize my thoughts because there's lots of things to reply to. But sure, it's easy for me to understand how somebody diagnosed with autism would struggle more in social situations. I think about, I have two daughters and raised in the same environment, very different from day one. So there's, they have different combinations of their parents' genes. And, that's sort of what happens is the mother and father both have 26 chromosomes. And when they get combined, it's like shuffling a deck of cards. And different children to the same parents have different shuffles. And there's genetic differences and brain differences. And all of that. I think you've made me think a bit more about what's the point I'm trying to make? Like, what's my bottom line? I think my bottom line would be I don't like promoting the idea that biology is defective unless we have evidence for it. Right? And so to me, that's That's certainly the chemical imbalance idea, like directly, like your brain's messed up, it's not working properly. And usually that has been, that very idea was invented by a pharmaceutical marketing company. And if you can get people to believe that, then they'll naturally go to their doctor and take the medication, and they make a lot of money from promoting that idea. The neurodiversity thing is coming from a different angle. And I would imagine that there are people who derive benefit from thinking of themselves as neurodiverse. I just, at the level of an individual person, I would get a bit uneasy if that person has adopted the identity that there's something wrong with their brain, and that therefore they're not like other people in a bad way.
Yeah.
Know what I mean?
And I'm so aligned with you on that. And that's something that I'm really passionate about is difference and uniqueness doesn't equate defection and disease and
Exactly.
So on. So I often think about or use the analogy, I don't know if you've watched the movie The X-Men.
Sure.
So there are these, the notion is that there are these people who are born with a sort of genetic mutation which makes them kind of different from the rest of the population, and that they use the word mutant, but you could use any word you want. And that uniqueness is both a superpower as well as it can be a hindrance or it can cause problems. And it's interesting because in the X-Men, often when those people are young, they struggle a lot to manage that uniqueness. And then they go to the Xavier School for X-Men, and they get trained into how to manage that superpower, to control it. And then they use it to do good in the world. And so I think that story is a perfect analogy for what I would refer to as unique brains, and whether it's ADHD or autism or bipolar or any of those number of other sort of unique brains, that it often does require help to manage it. Someone who has bipolar or autism or ADHD does need to help to sort of, what do you do? How do you function in this world when your brain, and this is my perspective, which we may differ a little bit, but that, and coming back, so that's one thing. But I suppose I can understand how if you take someone like one of those mutant kids, that they would feel uncomfortable in social situations because, so often they open their mouth and fire comes out or they've got these laser eyes. And so they're around all these other kids who they take their glasses off and they're just looking around and nothing happens.
Yeah.
So if, the little that I know about autism, it is something that creates difficulty in social interaction. And if you find those social interactions difficult and jarring, and then people might be more likely to make fun of you or even just that reaction. And I think that's something that is easy to sort of dismiss someone who's socially anxious as being, misperceiving of rejection. But sometimes in many cases, there actually is rejection going on. They are struggling to fit in. So that's where I'm really interested in that sort of notion of uniqueness, difference, and how it's so easy that leads to avoidance, but then that kind of creates a whole problem in itself.
Right. Well, an important part about how the mutant kids, I don't know what the right word is, overcame their struggles or learned to live a happier life, is they found the right environment. And that's an important thing for us to find an environment that fits us. And, if you have raging ADHD, trying to sit quietly throughout a boring school day might be a really difficult environment, but you might be an unbelievable soldier or something, right? Like I think helping people find the right environment is important. Back to the socially anxious thing, I've seen so many people with social anxiety who were awkward or teased or shy when they were younger in school. And, kids are mean when they're 12 years old. That's just a fact of life. And what happened often in these stories was there was something a bit different about them. They got teased, and then they concluded that people in general are mean. And then they developed a withdrawn way of being in the social world. And now I'm seeing them at age 20, age 30, and they're still acting like they're around 12-year-olds. But people have grown up around them, and they probably are much nicer now. But my client doesn't realize that because they're still avoiding like they're back in primary school. And so, our job is to help them look up and interact with other people and realize that they're a lot nicer than they expected.
That makes a lot of sense. And, in some ways, it's almost like maybe there was an intolerance of being a bit different and a bit quirky and maybe saying something a bit out of turn or whatever that sort of person did when they were younger and perhaps got teased for or made fun of or whatnot. But that, as an adult, people are probably going to be a lot more tolerant of that uniqueness and that quirkiness. So I think that's a really important thing to recognize. And it sounds like from what you're saying, that's the trajectory of how things like, say, panic disorder or social anxiety can develop, is that, the first time someone goes out and they have a panic attack and they're in a shopping center or they're in a public place, it's natural that they'll be like, this is really uncomfortable and I'm going to get out of here. In the same way that someone who doesn't fit in kind of goes, well, I don't want to hang out with those kids. So whether it's the panic disorder or the social anxiety person, they then pull away, but then they fall into this lifelong pattern of constantly avoiding and never get kind of the experience that actually that was a one-off panic attack and or as a period where they were really stressed and they were going to have a few panic attacks, and now they're 3 years into not leaving the house and permanently avoided, or they haven't gone out and socialized in years.
Mm-hmm. Yeah, well, I think that's what happens often. I'm just thinking back to when I was in school and, got bullied every now and then like everybody else. I didn't have a choice other than to just keep doing what I was doing and go, like my parents didn't say, you got bullied, we're going to homeschool you. or they didn't allow me to avoid going to school. Like I knew I had to go to school, and so I had no choice but to just get through it. And I didn't have a phone to stare at for hours telling me that I might have this disorder or that disorder, and to identify with a community of people to get my attention that way, and my connection with others that way, and just give up on having it in real life with real people. And, I feel like it's got to be even easier now than it's ever been to respond to adversity unhelpfully.
Yeah, so we've got this sort of, this real situation, whether it's a panic attack that came out of the blue, whether it's being a bit different, or whatever those number of things are. And then it leads into this pattern of avoidance, which, if I'm understanding right, what you're saying is that it then leads to no new experience. Tell me a bit about how exactly that pattern of avoidance feeds what can become now a really kind of crippling problem.
The most obvious thing that comes to my mind is it prevents them from learning that they're wrong, essentially, learning that things aren't as bad as they think and that they can tolerate their anxiety, and the negative outcomes they fear are less likely to happen. And even if they do happen, they might not be the end of the world. So if you're avoiding, you're not getting to learn any of those things. And the only way you're going to overcome the problem is by learning those things. So another problem is that instead of learning those things and overcoming the problem, you are doing something else, which is not moving you forward in valued directions in life. And, you're essentially wasting your time, doing distraction or whatever it is. I mean, time is going by and you're filling it, but just not with life-affirming things that help you move forward. And those can become habits that are hard to break over time. Because once that's established, the only way you're breaking that habit is by experiencing the discomfort that comes with changing it. And the longer you've been doing it, like the longer, I feel like, for example, here, school refusal. If a primary school child has a panic attack or something at school and they get sent home, the longer the parents keep them at home, the harder it is for them to get back in school. Like the longer you avoid, it just tends to maintain itself.
Yeah. So you're talking about what you're doing when you are avoiding becomes destructive in itself. What do you mean by that? Like, what are those things? Because we talked about alcohol, so that could be an example. Or I was picturing, when you were saying that, I was picturing someone that was like vegging on the couch and watching TV or something. Is that kind of what you're talking about? That's what I mean.
So like avoiding refers to not engaging in behavior. So if you're not engaging in desired behavior, what are you doing instead? And the answer is probably just sitting around, not doing very much. And there are standard ways that people pass the time, either by just being passive, or ways, and now with phones and the internet, people are going on to Google trying to figure out what's wrong with me. So like, have you heard the term cyberchondria? It's like hypochondria, but going to Dr. Google and diagnosing themselves, and like there's a whole rabbit hole you can go down, if you are so inclined to try to figure out what's wrong with you.
Right.
And there's lots of places out there that are happy to tell you all sorts of disturbing things. And so what are you doing when you're avoiding? What are you doing instead? Are you sitting around drinking, watching TV, scrolling through your phone? Probably none of those things are going to be conducive to quality of life, personal growth, or overcoming the problem.
And something I remember from my training, and it's definitely something that I've seen and I talk about with clients, is how with that avoidance, the problem feels like it becomes larger and larger. And so like, I'm just picturing someone who, for example, feels like they might not be fun in a party, or they just feel like they aren't someone who would fit in with that group. And in a way, the more they avoid, the more that becomes this sort of like Ben-Hur type of phenomena, where it's now like, if people found me not to be interesting, or if I didn't fit in with that group, that would be devastating. And so it seems like with avoidance feeds, it's almost like how like darkness feeds rot in a way, where the beliefs and the ideas around it and the gravity of it seems to grow. Yeah,
100%. And in that example, I mean, other people can get used to that person just being that way and stop encouraging them to come out, and that can sort of just lock it in as well. But yeah, what did you say, turning the something into rot? That was a good phrase.
It's like, if you have
the darkness into rot,
dampness feeds rot, and it's like sunlight is what kills rot.
That's a really good analogy, I think.
Right.
Yeah.
Okay.
Yeah. So at some point, if you want to get out of this, you're going to have to reverse course and turn the ship around, and get off the sofa and put the phone down and put the beer away and approach rather than avoid.
Yeah.
That's the only way to overcome it.
Yeah. Yeah, so it seems like what we are sort of talking about is how there's kind of normal, healthy anxiety. Then there is a whole spectrum where it moves into excessive avoidance. When it's excessive avoidance, it is inherently problematic for the person. Now, before we talk about kind of the way of working with that or way of managing it, tell me a little bit about perhaps what are the consequences of high-level avoidance? Like, what's the detrimental impact when someone is doing a lot of that kind of avoidance of anxiety?
Well, I mean, I think there are consequences in terms of maintaining the anxiety problem. That's an obvious place to start. But there are also bigger picture consequences in terms of life, relationships, career, like people put off having families, put off pursuing their dreams, and trade that for a feeling of safety today. And you might get that feeling of safety today, but I think there's an awareness at a certain level of depth that you're not living your life the way that you would really want to, and that can gnaw away at you after a while.
It's like a restricted style of living, right? Where you're not actually living a full life. You're living a life that's sheltered and constrained.
Exactly.
Yeah. And you mentioned about relationships, and that's certainly something that I've seen, is that because it's like, if it's your anxiety, it's kind of almost like easy to put up with a certain level of restriction, because it's like there's this terrifying thing, and I've got to balance between doing something that I'm terrified of or just adapting my life to avoid that stuff, right? And it's like, if it gets really bad, maybe it causes problems, but to a certain level, it becomes something that we can put up with. But when you don't experience that anxiety and your partner's saying, no, I don't want to go there with you, or we can't do that, or I don't want to leave the house today, like, you're not experiencing the cause of it, which is that internal discomfort. But what you're getting is someone that's severely restricting your life.
Yeah, you're getting the consequences. I mean, if you live alone, you can get away with sitting around and doing nothing, unless you're missing work. Like there's no natural consequences necessarily that show up. But if you're in a relationship, it's a different story, and you can turn the other person's life into a living hell if it goes far enough. I've certainly seen that.
Yeah. And so in some ways, maybe a lot of people might start to need to address this or want to address it because now they're in a relationship and the partner's saying, I'm not going to accept, more or less, but like it starts to create friction because now the partner is saying, I don't like to have to wash my hands 5 times and 10 times before I enter the room each time that I want to see you. Like you don't mind doing that. And when you're balancing the pros and cons of it, you end up feeling like it's a price that you're willing to pay and you've been doing it for years, but then the partner goes, now you need to address this.
Right.
Yeah.
Right. What this makes me think of is the tendency of partners to accommodate the other's anxiety.
Okay.
Which is to sort of join forces in helping them avoid and seek safety and feel safe, which they might do out of a sense of love, thinking that it's the compassionate thing to do, or they might do to just reduce arguments or hassle and just make life easier for everyone. And it's the same thing that a parent might do with that child who was bullied yesterday and doesn't want to go to school today. And they're putting up a fight and throwing a tantrum. Well, the easiest thing to do in that moment is to just let them stay home. But that accommodation of that anxiety just maintains the problem over time. And often partners find themselves inadvertently being like a key maintaining factor of the anxiety problem.
Yeah.
And overcoming the problem means that both people have to change the way they behave.
Right.
Yeah.
It's interesting because I probably see the opposite, but just for the nature of my work. Like when people would come to see me, when couples would come to see me, it's where they're having a lot of friction and problems. So the ones that they're doing the accommodating thing, I probably just see them a lot less.
Yeah.
But it's really interesting to hear that you might hear about stories or people might tell you about the way that they have been kind of allowed to continue this behavior through their relationship. I hadn't thought about that. So we've got impacts on relationships, constrained life. Is there any other sort of consequence that you commonly see as a result of that avoidance and that sort of excessive anxiety pattern?
No, I think you just hit the nails on the head. Like the social avoidance leading to missed opportunities to do the important things in life is the one that really stands out to me the most. Putting off having a family, putting off being in a relationship. It's a challenging dating world nowadays. And so there are a lot of people who just aren't doing that. I think it's just missed opportunities to do the things that a person might actually truly value in life because they're trading them for a sense of comfort and safety.
Okay.
Which also contributes to the perception that you're not resilient as a person. And, if you want to overcome an anxiety problem, as I said, I think you need to stop avoiding and face it. But what if you've convinced yourself that you can't do it?
Yeah.
Because you've been avoidant for so long, you've lost all faith in your own resilience.
Yeah. And there's a couple of others as we're talking is coming up for me. So I might throw, but although we've sort of touched on them somewhat. So we've got constrained life, impact on relationship. We've got that, what you're saying, which is a low confidence in a way, because it feeds into this sort of idea that I'm not strong and capable. And that's a consequence of that avoidance. We touched a lot on alcohol, and I think that's one that's worthy to sort of really emphasize as well, is that a lot of people have dealt with their anxiety for so long and they've now become essentially alcoholic or have a real problem with anxiety. And the last one that I would throw out there, and it was really interesting that when I moved from my studies into clinical work, I started getting people who would come to me and say, I've been diagnosed with depression or I have depression. And when we kind of looked at what's causing it, like why is this person depressed? I found that and who knows whether my sample and the people I saw was representative or not, but probably about half the people who would come saying that they suffered depression actually had either social anxiety or generalized anxiety disorder underneath, that sort of GAD tendency to worry.
Okay.
So it was just something that was really interesting for me to notice how often an unmanaged anxiety problem can actually lead to depression as a consequence. And I don't know if that's something that you've observed or seen as well.
Yeah, that's quite common. A serious anxiety problem can be depressing in terms of the way that it affects your life. And the depression usually gets better when the anxiety gets better.
Yep.
Yeah.
Okay. So, impact on life, big pattern of avoidance. Is there anything, before we go on to this sort of idea of what to do about it, is there something that feels like we've kind of missed from this discussion so far?
I just have one other thing to add to the list of negative impacts of this stuff. Physical health problems.
Right.
I mean, if you're a chronic alcoholic, there's all manner of physical problems you can develop.
Yep.
Even something more mundane. If you're just sitting around not doing much, you can become physically deconditioned. You can gain weight, lose muscle, and then it can be harder for you to, to do what you need to do. Like literally, physically more difficult. Like behavioral activation, is an effective way of overcoming depression, which is just increasing your engagement in pleasurable activities like exercise. But what if you've gained 100 kilos?
Yeah.
Walking down the street might hurt, and now it's harder, and that can become a cycle.
Yeah.
Yeah.
Okay, good. There is one final thing that is coming up for me as we sort of talk about these sort of pattern of avoidance and anxiety before we move on to what to do about it. And that is the issue of what in psychology we call GAD, generalized anxiety disorder, or what's often commonly talked about is worry, because it seems like it's a very pervasive, very common form of anxiety or manifestation of anxiety, which takes the form of worry, which is a form of avoidance. But it feels to me like it's very hard to recognize. And I've seen a lot of people who've come to see me for therapy, and it's never been picked up before. And so when you have worked with anxiety disorders, is GAD a common form of anxiety problem that you will work with?
No.
Right.
The reason why I say that is, first of all, I don't tend to think in diagnostic terms very often. I'm more interested in is just understanding the context around the problem, what's happened in the person's life, the meaning they make of it, what their concerns are, what the triggers are, safety behaviors, and so on. Okay. So I don't find using diagnoses to be all that helpful in terms of explaining it. Sure, worry is very common. And I want to know what the person's worrying about and how accurate to the situation that worry actually is, and like what safety behaviors, all the usual stuff. So what you might call GAD and what our diagnostic manual might say is GAD. Yeah, I see those people all the time. I guess I just don't think about it as these people have GAD.
Okay. So I would presume then by extension that if you see someone with more of that sort of OCD style anxiety, so to say washing hands or some ritualistic kind of behavior, you then also don't differentiate that so much from, say, social anxiety or, say, panic disorder or something like that?
Well, I'm more interested in what the person's concerned about. I mean, like everybody with an anxiety problem, they have beliefs about threat. With regard to whatever the situations are. And so, I mean, I'll use the phrase OCD, sure, with a client, but only after I've made it clear that that's just a descriptive term for describing a type of problem. It's not an illness that you have, like cancer. It's just a way of describing a type of problem. And even within OCD, I have 3 people I'm seeing right now for OCD with completely different concerns. One person is afraid of becoming a lesbian. happily married, just had a child. Another person was afraid of stabbing his wife and beautiful baby boy. And another person is afraid of being contaminated by germs and developing a terrible illness. Those are 3 totally different problems with different triggers and different concerns and different safety behaviors. And I'm happy to use the term OCD, but it really doesn't explain much. You know what I mean?
Yeah. Okay. And so when you talk with that person, you're more interested in what are they fearing? So for example, stabbing their partner or being a lesbian. So that's kind of like the threat or the perceived threat.
Correct.
You then look at the pattern of avoidance. What do they do as a result of that? And so would there be a form of avoidance? Let's take those 2 examples, the stabbing the partner or those 3 examples, the germs, stabbing the partner or being a lesbian. What sort of form of avoidance would those types of fears lead to?
Well, it's entirely individual, right? So they're very different. Like I'll give you some examples for the person who's afraid of becoming a lesbian. And he's just does a nice job of illustrating how fascinating the human mind can be. So for over a decade, she has avoided listening to any song with a female vocalist, just to be safe. Right. And in her mind, that's a trigger because she might, like the song and then think, oh no, what if that means that I'm attracted to this person? Right. And just, lots of avoidance of anything that might expose her to looking at or thinking about an attractive woman. So no TV, no movies, no magazines, almost no phone. Just like very careful not to be exposed to that. Avoidance of eye contact, and then lots of reassuring and distraction because she has a job, she's in the social world, she's around other people, can't help but being confronted by attractive women on occasion. And then there's all of these mental gymnastics that she'll do to try to undo the possibility that noticing an attractive woman means that she's a lesbian is going to leave her husband and ruin everybody's life.
Okay, so what I'm guessing is that with that person, there might be a lot of almost trying to avoid the thought might be the biggest thing where like I'm sure most people would consider in different moments, oh, am I this, am I that? And for most people, it's a passing thought that then, because you allow your mind to consider it, you can kind of toss it around in your mind and then you can kind of move on from it. There was a really interesting study that I came across when I was doing my studies around thoughts of harming someone, that when they interviewed college students and they asked them about, have you ever thought of pushing someone onto the railway track, or have you ever thought of kind of crushing a baby's head on the concrete, or these horrific things, but that it was like 80 or 90% of people would endorse. And if you probably took a whole sample of like 100 people, it would be 80 for one of those thoughts, but probably any form of aggressive or harmful thought would probably have ended up being the whole group. So it's something that study kind of showed that those kind of perverse and strange thoughts of harming someone really innocent are actually common, but the non-OCD type person would probably just let it pass as a thought and go, oh, that's strange that I thought that. But the OCD then kind of goes, uh-oh, I'm having that thought. That's terrible. I've got to stop having that thought. And even if it's not real avoidance of railway tracks or anything else like that, it seems like there's a kind of avoidance of that thought.
Exactly. Yep. I think that's all exactly right. And so what it comes down to is differences of opinion in what a thought means. And like we all have bizarre, weird, violent, inappropriate thoughts frequently. Like I think the number is probably more like 100% if we're being honest. But we don't all have OCD. So why not? I think the difference is some people believe that the mere presence of the thought means that it could come true or that it says something bad about you, like you're a horrible person. And that's called thought action fusion, the idea that you are what your thoughts do. So bad thought equals I'm a bad person. Whereas people who have those same thoughts, I think most of the time, just to the extent they even notice them at all, they pay them no attention because they think they don't mean anything. So if I have a crazy thought, I'll probably just chuckle at the fact that this weird thing just happened in my mind, and 2 seconds later move on. Because I don't believe that the presence of that thought means it's going to happen, that I'm going to act on it, or that I'm a bad person. But a lot of people are walking around with a totally different relationship to their mind.
Yeah. Okay. So we've got the kind of how someone feels about a thought or how they react to a thought. And it's that kind of, it's almost like it's the fear of that thought, which then creates that pattern of trying to keep that thought at bay.
Right.
And it's interesting because like with PTSD, what I've noticed from my work with people who have something akin to PTSD is it's like their brain can't process that memory. So every time the memory kind of attempts to get processed in the brain, it gets pushed away. And then that creates the whole pattern that we would commonly sort of refer to as PTSD. So we can have like social anxiety, which is avoiding people and being ourselves, or we could have OCD type anxiety, which is more avoiding or not being tolerant or accepting of a thought. Or it could be the PTSD, which is the pushing away of a memory. And so they're quite different forms of avoidance though, aren't they? Like not going to a party and not giving a public talk or not leaving the house for panic disorder is actually quite different from pushing away a thought and not wanting a thought.
Yes and no. I mean, on the surface, they look totally different. But it's the same processes, psychologically speaking. So we begin with a person has a belief system that says this particular thing that I'm anxious about it is bad, intolerable, something bad's going to happen, whether it's a memory of a trauma or a social interaction or body sensations that you've associated with panic attack. So the person has a belief system that says they're bad. And so they're essentially just walking around waiting to be triggered. And whenever the trigger shows up, boom, anxiety kicks in, and you have all of the internal stuff that goes along with that, and then you feel compelled to seek safety, and it just maintains the cycle. But what that looks like is totally dependent on the person and their own unique concerns.
I think that we're probably more aligned than we initially appeared, but that's where I would probably have or feel like there is some utility in the word OCD versus PTSD is because it helps me to sort of, if I'm working with that or talking with someone, to be able to sort of in my mind anyway, and regardless of what word we use, but to categorize it, what they're pushing away is a memory versus what they're pushing away is an uncomfortable, perverse thought versus what they're avoiding is being themselves or engaging with others. So that's where, for me anyway, and I'm not sure if in your work you actually do need to have that distinction or if your style of working means that you really don't categorize, but it would seem to me like that's where those labels come from, is it's a way of separating what they're avoiding in a way.
Yeah, that makes sense. So, I might begin after I've gotten to know a client and their story, I might begin my feedback by saying your experiences meet a diagnostic criteria for OCD. OCD is just a descriptive term for the type of problem you're experiencing. It doesn't mean that your brain is broken or that there's anything medically wrong with you. It's not a chemical imbalance. It's just the name of this type of problem.
Yeah.
Now, if we want to really understand it and explain it, we have to go deeper and we have to look at the context. And then from that point on, that's where the action is.
Yeah.
Looking at the beliefs and triggers and behaviors and stuff.
Yeah. And that makes a lot of sense to me, that in a way, what it sounds like you're trying to avoid is for the person to take on this label and to kind of go, I'm sick, I have a disorder, I'm broken. And what you're trying to do though is go, hey, we've got a word and we understand what you're experiencing. We can call it X, but it's just a way of describing this pattern. And then let's move into solutions or what we're going to do about it.
Exactly. I would add that I think it probably was therapeutic for the guy I saw who was afraid of stabbing his wife and son, for me to say, you're not crazy, this is OCD. Because those were like the two possibilities. One is he's like secretly homicidal because he's having these thoughts. And number two, this is a well-known type of anxiety problem. And so in a situation like that, it probably was helpful.
We've talked about how PTSD is the sort of avoidance of a memory. Social anxiety is the avoidance of people or being yourself around people. I've mentioned panic disorder, this sort of fear of having a panic attack in certain places, therefore not going to certain places. OCD, the kind of the discomfort of either a thought or germs is another form of OCD. So we've got either sort of the contamination type of OCD or an intrusive thought type. Coming back to, because I find this issue of GAD really fascinating, and it's something that I've seen a lot in my work. What would you say is the underlying fear or avoidance, or what is it that, if PTSD is a memory and OCD is a contamination or an intrusive thought, what is underlying the GAD type of pattern then?
Well, I think that's less clear. People can worry about anything. And, there's no like prototypical, most people who, fit the diagnosis of GAD worry about these two things. Like, but I haven't experienced it that way. And if I put my professor hat on, I don't think GAD is a very credible diagnosis. So like, if you and I saw a client and interviewed them, the odds that we would agree that they have GAD is like 30%. Like the agreement between multiple interviewers for GAD is very poor compared to some other diagnoses. And so, yeah, I don't really have like a prototype of that in my mind. The way I do for like OCD or PTSD.
Yeah. I read one book on GAD which was talking about it's a discomfort or it's an avoidance of uncertainty. And it seemed like that's a hard thing to pin down, because exactly what is uncertainty? But it seemed to me that, let's just take, for example, you go to the supermarket and you have to choose between two different products. There's uncertainty about whether the one that you're going to pick is the right one. Now, for a lot of people, it seems like when faced with that uncertainty, they just reach and they grab one, and it's kind of like they're not bothered by that uncertainty of whether it was the best product or the one that's ideal. But it seems like, in my experience, GAD is something around that kind of fearing or a discomfort with uncertainty.
Yeah, I think thinking about it at the level of the psychological processes that are happening is more useful than like the content of what people worry about. So yeah, I think it's the intolerance of uncertainty.
Yeah.
And, if you and I were to get behind the wheel and drive, if we really stop to think about it, like there's no guarantee we're not about to get into a car accident. But we know the odds are so low that we probably decide they're close enough to zero that it's not really worth worrying about, and I'm going to continue to drive. But some people, not having a 100% guarantee is too risky.
Yeah.
So yeah, and people vary in how able or willing to tolerate uncertainty they are.
Yeah.
Another interesting thing related to this is worry is actually a safety behavior. Yeah. It's something that people do because they think it's helpful. And so people diagnosed with GAD tend to have positive beliefs about worry, as if it's helping them foresee what might happen and plan for it.
Yeah.
Even though there's a difference between worrying and planning.
Yeah.
Planning is, well, I'm concerned about this situation, and so I'm going to come up with what I think the best way is to handle that situation. And when the situation comes up, I'm going to do that and test it and see how well it works. That's planning. Worry is just what if this, what if that, and never really graduating on from there.
Yeah. And that's exactly been my experience with GAD, is that it feels to me like the worry is, it's almost like when you play a chess game in your mind and you go, if I move my pawn there, my opponent would be able to take that pawn. And if they take that pawn and move their piece to that square, I could then take, and in a way, when someone is faced with an uncertainty, so take, for example, they go to the supermarket and they're faced with these two products, they start to worry about, well, what if I bring it home? And what if my partner then doesn't like that product? And what if I can't return it to the store? And what if we end up having a big fight that whole evening because I've brought the wrong product home? And what if that then it means that we don't go on our trip up the coast? And so from this simple thing, like they're trying to choose between two products, and in a way, it's almost like that can create such an issue in itself, because then they might end up spending half an hour at the shop and they're running late, and then their partner ends up getting upset because they're running late.
Right.
So it can in some weird way sometimes become a self-fulfilling prophecy, Gad. But yeah, I have definitely seen how it's like thinking so many steps ahead as a way to try to reduce the uncertainty, but that actually then creates that kind of experience of anxiety that often then accompanies GAD.
Yes. Taking a step back, a number of common types of anxiety that we've discussed just really involve people fighting an internal battle in their mind. And there's some common ingredients, like a thought shows up. What if this bad thing happened? And then rather than just leaving it alone, or testing it out to prove that you're safe, people start to think about the thought, and they essentially fight a battle within their own mind. And the flip side of that is a person living in harmony with their own mind, and understanding that their mind has a mind of its own. And if your husband is on his way home from work and you're waiting at home with dinner, and your mind says, what if he gets hit by a car and dies on the way home? That doesn't mean that it's so likely that you need to pick up the phone and call your husband, or that you need to distract yourself or reassure yourself. That's just your mind doing what minds do. They're sort of idea generators. And a lot of the ideas are wrong or dumb, but that's just the nature of our minds doing what they do. And if you understand that, then you can watch your mind from the sidelines as if you are an observer, and to just sort of say, thank you, mind, for that thought. I'm going to get back to making dinner. And so I think learning to just allow the stuff that's in your mind to be there without over analyzing it or trying to fight it is an essential skill. Like if we're teaching, mental health literacy in schools, that's what we should be teaching. Like how to understand and learn to live with your mind.
Yeah. This is a total side note, but incidentally, I actually created a program for my PhD, which was an ACT-based program for schools for preventing mental health problems.
Did you really?
Yeah.
Oh, wow. So I'd love to hear about that.
Yeah, okay. Yeah. I'll talk to you more about it another time. But this is actually probably, Brett, a perfect segue into this idea of what to do about it, right? Because as you say, what you're talking about here is the beginning of examples of techniques or strategies that we might use when our mind is in a way working against us. So just in the same way that if you have a flu, what that is your body is fighting this virus, and often the body fighting the virus is creating all of these symptoms. And so what you need to do is to rest. But when your brain is kind of fallen into a pattern that's unhelpful, and you're needing to perhaps counteract some of those natural tendency, such as moving away from uncomfortable stimulus, or reacting to thoughts in the way that you've just described, we need to be more active in our kind of dealing with it and managing it. So I know that with anxiety, a big kind of technique is around exposure, but perhaps before we even go down that rabbit hole of exposure, if you want to just talk about what are the techniques, broadly speaking, to deal with anxiety? And then of those, we can perhaps pick one, such as exposure, and talk a bit more in depth about it.
Sure. There's so much that could be said on this topic, but I actually think ultimately it's a simple lesson, which is if you want to overcome an anxiety problem, you need to approach rather than avoid. And I say exposure, but I really mean approach. Which, I envision a person who's stuck in a cycle of avoidance, sort of standing up and turning around in the opposite direction and moving that way. And that's walking into it, leaning into it. And there's no way around the fact that is uncomfortable and new and different and likely to be challenging at first. But it's only through accepting discomfort and willingly experiencing it that you can, I think, overcome an anxiety problem. And people people I see have often tried for years and years and years to avoid their way out of an anxiety problem. And therapists are really good at helping people try to avoid their way out of an anxiety problem with strategies like teaching them to relax and to practice mindfulness and diaphragmatic breathing and trying to replace negative thoughts with positive thoughts and examining the evidence for their thoughts to try to reassure themselves that that bad thing is less likely to happen. What those all have in common is that they're not countering avoidant behavior with approach behavior. They're all doing something different, tangential to that. And I just don't think they're very helpful. If I were to teach you diaphragmatic breathing right now and say, when you feel anxious, use this, you might feel a bit better when you use it, but it's not going to help you learn that you're wrong, that the thing that you're afraid of doesn't happen and that you can handle your anxiety. And that's the whole reason you're anxious in the first place. So they're sort of like Band-Aids. And I think that's what most therapists do. And most therapists, anxiety is the most common type of problem that people experience. And so every therapist learns how to help people with anxiety in school. But mostly what they learn are these distress reducing techniques. And I don't think overcoming an anxiety problem should be thought of as using techniques. I think it should be thought of as changing the way you live your life from one organized around avoidance to instead organized around approach. And that works if you're willing to do it. Go ahead.
Oh, so what you're saying is that there can be some well-intended strategies, even kind of promoted or taught by a mental health professional, such as a psychologist or therapist, but that can actually feed part of the core problem, which is doing things to try to avoid the feeling.
Yes. Can I use a case example to illustrate this? It's sort of a bit confronting.
Right.
I mentioned that I have a client who is afraid of, or was afraid of, stabbing his wife and young son. And he's a loving, gentle guy. He's the last person in the world who would actually do it. And he loved them more than anything in the world, which is why he was so freaked out by the thoughts. He'd had this problem for almost a decade, and he'd seen a psychologist every fortnight for almost a decade. No improvement. And did the things that I mentioned, the mindfulness and the thinking about thoughts rationally and the relaxation. And the question would be, how do those things help him learn that he's not going to kill his family? They're sort of serving a different agenda, which is for him to calm down and relax and to think more rationally. But they don't logically help him learn he's not going to do it. Only one thing can. The only one thing I can think of, which is to abandon the safety behaviors, pick up a knife, and find out what happens. If we really want him to overcome this fear, not just learn to live with it and take the edge off, but overcome it, for him to learn for certain that he's not going to kill his family, there's only one way to do it. And after 8 sessions, he's cured. He's convinced that he's not going to harm his family and that this whole thing was just a misunderstanding with his own mind.
So you actually got him to take a knife in the presence of his family when he's someone who's terrified that he's going to stab his family.
Correct.
Wow, that must have been a confronting exposure to do for him, and possibly as a therapist. You're sort of saying take a weapon for someone who's had thoughts of harm. Yeah, right.
Yes. Well, it was certainly confronting for him. That's like facing his worst fear.
Yeah.
And shortly thereafter, his anxiety had subsided, and he's holding a knife, realizing, I don't want to stab my family with this. Why did I think I was going to do that? That's dumb. And he thought that because he was in a heightened state of anxiety and he had to get through it to the other side to calmly realize that I was wrong about this the whole time. Now, I'll reiterate, he's the last person who I think would have actually done it. That's why he was so anxious about these thoughts. If he were actually a murderer, he wouldn't be in my office saying, help, I'm anxious about these thoughts. He would find them enjoyable, pleasurable.
Right.
Now, it wasn't anxiety provoking for me because I knew he wasn't going to do it. But for most therapists, it would be. And most therapists, I don't think, would have done that.
Yeah.
They would have made the therapy about them. And that's often what therapists do, is they use these feel-good, distress-reducing techniques instead of exposure because they're more comfortable with it. Not necessarily because it's better for the client, but it's better for them.
Yeah. Interesting. So this is an example of someone who had intrusive thoughts about harming their family, specifically with a knife, and you got them to gradually or just immediately take the knife and be around them?
Gradually. So we started with exposure to the thought itself.
Yeah.
Like he wrote out a scenario, like the worst case thing happening, and he read it out loud while recording it with his phone. And then he listened to that recording over and over and over and over and over and over again. And in less than a week, he found it boring. So that was the starting point. And then he practiced holding up a knife to himself, to me. That was a fun session. And he gradually worked his way up to doing it with his family.
Yeah.
And actually, our final meeting was watching part of that session. We watched Fight Club,
Right.
which I love that movie. Have you seen Fight Club?
I have.
It was, part of the theme of Fight Club is one of the main characters loses his mind and becomes, homicidal or really violent. And that movie is triggering. So for him, it's not enough to just hold a knife, but he has to be in a state of concern that he's going to lose his mind and go crazy. And only after we had done all of that was he able to be convinced that this was completely wrong. It doesn't matter if Brett's around or not. It doesn't matter, what size knife I'm holding. It doesn't matter if I've just watched The Joker or Fight Club. I'm not going to do it, period. And I know that now. And that was my goal, to help him get there.
Yeah.
And we got there in 2 months.
Yeah. It's the experiential learning. It's so powerful, isn't it?
It is.
Yeah.
And there's no way I could have persuaded him with reason.
Yeah.
There's no way.
Yeah.
I could have tried my very best.
10 years. You could have
10 years.
repeated the same phrase.
Exactly.
These thoughts are nothing. They're not going to harm you.
Exactly.
Yeah. Sucked him for money
Yeah.
and filled up your bank account,
Right.
and you would have been doing a huge disservice because
Exactly.
This is the technique that'll work fast and effective and actually get the job done.
Exactly.
Yeah.
It works if you're willing to do it.
Yeah.
And it helps having a therapist who knows what they're doing and can help walk you through it and explain it and persuade you to do it and be there with you when it's hard and you want to quit.
Yes. And I think it's even hard to find someone because you as a client, we know this technique and we know that it works. But if you're someone who's outside of the industry of psychology and you have this recurring thought and you go to knock on the door of a therapist, they need to help you to convince you that this is the best approach.
Yeah.
So not only do they need to believe that it's the best approach and be willing to use it, they need to be able to actually work with you as you go, but surely we don't have to, and isn't there something else, and so on. So I think that role of the therapist is key because the reluctance of the client is probably going to be most clients. Most clients are probably not going to turn up, say, hey, I'm really keen for you to stick a knife in my hand and to bring me close to my family.
Well, yeah, I agree with all of that with one caveat. But let me just get to the caveat. I think most people understand that they have to face their fear to overcome them. They're just trying to postpone that because they don't want to experience the distress.
Right.
I think most people get the logic behind that.
Once you explain it.
Yeah. Well, I think most people just... For me, that's sort of common sense. I think most people have that as a bit of common sense,
Right.
Which doesn't mean that they're happy to come to my office and hold a knife on day one.
Yeah.
But often I've seen people who have tried everything other than facing their fear, and I think they realize that it's finally time.
Yeah.
They just need to do it.
Yeah. I think also sometimes what can happen is that they might have felt like they tried exposure therapy or CBT and that it didn't work. And I've heard a number of people kind of go, oh, I've tried that. But what I suspect is it was probably badly done.
Yeah.
And so things like that gradual, they call it gradual exposure. So slowly working your way up to it, making sure that it's set up properly is so essential for it to have a chance to work, right?
Totally agree. I think often therapists say they do exposure, but only assign it as homework and don't actually do it together with the client during the session, which is so important to do. If I would have just said, this week, go hold a knife next to your wife, without me having already laid some of the groundwork for doing that in person, he probably wouldn't have done it. He would have thought, this is too hard, I can't do it. So yeah, having a therapist who knows what they're doing is really important. It's a challenging therapy for therapists, but every time you do an exposure as a therapist with a client, it's an exposure for you. And the more you do it, the more comfortable you become at it and the more confident you can be. And you can hand, at a certain point, a knife to this guy. And you can sit across from him calmly when he's highly anxious, modeling, showing that you have no concern over what's happening. It's hard to do that straight away, when you're in graduate school, but you can get there if you stick with it. I was going to say that therapists who are somewhat understandably inexperienced, not confident in the approach, can unintentionally sabotage it. And a way that might happen would be you could have the knife, let's say during that session, and say something along the lines of, okay, well, I have this knife here. When you're ready, you can take it out of my hand. I'll be here in case anything bad happens. Remember, you're not going to do it. And I could subtly act in ways that betray my lack of confidence that he can handle it, or that's going to turn out okay. I can try to reduce his anxiety by reassuring him. Like
with a plastic knife. I think a lot of therapy, even if they got to that level of doing exposure and doing it with a knife, I bet you half of the ones that actually do it would do it with, say, a plastic knife, just to avoid the risk of...
And I'm sure you're right. And what message would that send to him?
That actually he might be dangerous with a knife, and that the therapist
that he can't be trusted with a real knife.
Yeah, exactly.
I don't trust him with a real knife, and therefore he's not going to trust himself. Yeah. So exposure is a therapy where the therapist's own stuff gets directly translated to the client.
Yeah. So with that example of that individual, did you go to the family house and do this? Because this is where it's one thing to talk about exposure and doing it with a client, but the reality of what if he lives an hour and a half away and do you go there, or does the family come into the office? Practically, how does that exposure work?
First of all, I think ideally you meet face to face. You can do telehealth, but face to face is ideal. And I did make a home visit
with that individual.
Actually, I made 2 home visits.
Right.
One early on was to meet with him and his wife and help her understand our approach and the theory behind it, and to help her learn to change the way that she behaves around him so she's not accommodating his anxiety. And when he asks for reassurance, for her to deliberately be non-reassuring.
Right.
So and we had some fun practicing that. He was like, well, what if I kill our son? And, she used to say, no, you won't. And so now she learned to say, well, you might. There's only one way to find out. And that worked great because it made him immediately realize the silliness of his question. Yeah. And it made him realize there's no point in asking her for reassurance because he's not going to get it. Yeah. So that was valuable. And, with this kind of therapy, it's really important that people have their head wrapped around what we're trying to accomplish and where we're coming from. Yeah. Which is that he's the last guy in the world who's actually going to act on these thoughts. And therapy is about helping him know that. And then we did the home visit where we watched Fight Club. That was our last session. His family was coming home after that, and then he was going to take out a knife around them. And, it was eventually he's going to have to do that without me there. Yeah. And he was ready and willing to do it. Yeah. Dear friend of mine, former student from the US, has the best outcomes of all 600 therapists who do telehealth exposure therapy for OCD for this company in the US called NoCD. She's getting 85% remission rates with her clients from Zoom sessions only. She's not in their home. She's not even seeing them face to face. So, I mean, there's no reason that my client couldn't have done the knife exposure in front of a laptop.
Right.
So you can creatively find ways to bring the therapy into the client's home, even if you're not there.
And that, I think that was what my point was going to be, is just around, like, I can imagine that if you're a psychologist in a private practice and you're working, 4 or 5 days a week, and you've got 6, 7, 8 clients in a day, and you've got back-to-back appointments, like, to arrange yourself. I mean, already there's a cost there where, like, if you're charging your hourly rate and you have to now add the travel time to that person's home and the travel time back, like, it can create an obstacle to people to do this. But as you say, and that's where I think sometimes the homework has kind of evolved in the industry, is because of both the cost and the time and the impracticality sometimes of doing it. But I like your push towards not doing that as a default and not doing it unless you really have to, because what I'm hearing you is that as much as possible, you should be doing it with the client.
Yes.
Yeah.
Yep. I agree with all of that. One of my rules that I try to follow religiously is the first exposure should always be done together with the client.
All right. Interesting.
And I don't care if it's really easy.
Yeah.
What I care is that it has a good outcome.
Yeah.
For the client to learn that they can handle it, and disaster didn't occur, and I'm there to control the process and how we talk about it. And if I were to just assign it as homework, I'm worried that they're going to give it a go, get too distressed, stop, and come back and say, I can't do it. It doesn't work for me.
Yeah.
Yeah,
fascinating. Mm-hmm. The example of the person who had fears or thoughts of possibly being a lesbian, how do you do exposure to something like that? Don't tell me that you got her to have a sexual experience with a woman and realize that she didn't enjoy it.
Are you trying to get me to lose my license? Well, I mean, we have a look at the safety behaviors and then imagine what it would look like to do the opposite. So rather than avoiding listening to music by a female vocalist, well, we'll listen to it. But, the question is, for me, how can I help this person learn to the fullest possible extent not to worry about becoming a lesbian? Mm-hmm. Like, what would she have to do in order to learn that to the fullest possible extent? Mm-hmm. And once we get toward the top of that list, it gets pretty full on. Like, I don't know, what would be on there? Watch porn clips.
Right.
Go to a lesbian bar.
Right.
Probably, I would want to have the conversation with her though, like, what kinds of experiences would be the most triggering, where you would be the most concerned that the bad thing would happen, and that if you did it and you stayed in the situation and it didn't happen, that you would find to be the most valuable.
Right.
It would probably be stuff like that.
Interesting. Yeah. So it's really about targeting the safety behavior in a way, or the avoidance places, situations.
Based on their concerns about the bad thing that the safety behavior is protecting them from. Yes.
Yeah. Okay. So by getting this lady to put herself in those situations where she's exposing herself to kind of stuff that would trigger her anxiety quite strongly, being in a bar or images or songs, she's learning that actually she can have thoughts of it, she can be in that bar, and she's not going to jump on that woman and start to make out with her or feel a strong sexual arousal with that person. So those situations I can see. What about, now this is, I have a friend, psychologist, who has a fear of airplanes, right? Now, I don't know how she went about her own self-exposure, but she'd said that she had gone on an airplane frequently, and yet it hasn't subsided her fear of the fear of flying. Is there something in that maybe she was micro kind of avoiding in that?
Sure. Really quick, coming back to those other case examples, I think a huge part of what they're doing in exposure is learning to tolerate uncertainty.
Okay.
So like my knife client can do a knife exposure with his son, and what he learns is, well, I didn't do it this time, but tomorrow's another day. So what he's really going to have to learn is to just allow that concern to be there, allow the uncertainty to be there, and to just embrace that. And that just gets easier over time. The fear of flying would be my least favorite issue to treat because there's no halfway exposure to flying. Like you either get on a plane or like how do you work your way up a hierarchy to flying? Yeah. It's pretty,
I mean, you could go to an airport.
I know, but
ultimately,
I mean, really, do you think
there's a big step between?
There's a big step. So you just need to fly. But that's a really interesting question. So like you can do an exposure that one might think would help you overcome your fear, but have that not happen. And then, I would want to know, well, what exactly is she afraid of? I'm assuming it's the plane that's going to crash.
Probably, yeah.
According to her mind, why has her experience on these flights not convinced her that that's going to happen? And I'm guessing we're back to intolerance of uncertainty. Well, it didn't happen this flight, but who knows if it's going to happen to the next one. So I would want to get as much clarity as I could about how she's interpreting what she's learned from this, and to see if there's any subtle avoidance or safety behaviors. And not only that, but I mean, depending on the context, she could deliberately heighten her anxiety on the plane. I don't know if she's doing anything to take the edge off or reassure herself, but, drink a couple of Red Bulls or something before you get on the plane. Make yourself hyperventilate if it's going to make it turn out to be a more convincing learning experience.
So this is triggering a few recollections about what she did say. And she said, I know logically it's safe. And she's a smart, educated person. So she knows that airplanes are safer than cars. But she said, my body goes into that panic, and I've put myself in that situation multiple times, and I still get that kind of visceral body activation where she kind of goes into this high state of anxiety. Okay.
Well, I'm just taking a guess. No idea if this is true, but I would guess that when that happens, she responds by trying to control that or reduce that uncomfortable panic-like response. Probably. And I mean, the most effective treatment for overcoming panic disorder, which is the fear of panic, is to induce panic-like feelings through, I just gave you an example, have those 2 Red Bulls, make yourself hyperventilate. My advice for her, if she were my client, would be to deliberately bring on the sensations on the plane rather than doing the opposite and see what happens.
Yeah.
Yeah. Because sometimes in a situation like that, people are as afraid of their own anxiety as they are of the plane crashing.
Yeah. Okay. Yeah, I suspect that there was a bit of sort of white knuckling type of thing, and I don't know how that fits with what you're saying, but I think that probably it was like, I've just got to get through this, I've got to get through this.
Yes.
And I don't know how that's different from the full exposure or kind of allowing those feelings.
Okay. Well, I would want to know if she didn't white knuckle it and just allowed it to be there and build, what would be the worst thing that would happen? Would she lose control? Start running around like a crazy person? Would she have a heart attack? Would she pass out? Would she become psychotic? And if the more I know about that, the more I can create the perfectly tailored exposure session.
Yeah.
So that's why having this like really detailed knowledge of the context is so important.
So could there be almost a bit of panic-like anxiety mixed with aviation phobia? So the person is kind of starting to get kind of really uncomfortable with their own feelings and doing things to kind of get rid of those feelings. And it just happens to be on a plane that it occurs.
Yes, I've seen that many times. Right. I mean, if you have a tendency to experience panic attacks, and when you're panicking, you're worried that one of these embarrassing things is going to happen. You don't want that to happen on a plane.
Yeah,
like that would be a really bad place to like freak out. Everyone right there, like staring at you. Yeah. The number one fear that people with panic disorder report is embarrassment.
Right.
And a plane would be an embarrassing place to lose it.
Yeah. And so with panic type anxiety, you expose them to the actual, so elevated heart rate. You get them to, I've heard psychologists like spinning someone on a chair.
Yep.
You do those sorts of things like that for.
Yes, you induce, you find an exercise or a substance or a way of inducing the feared body sensations that the person interprets as dangerous or intolerable. And you can have them hyperventilate. You can have them breathe through a thin straw so they're barely getting any air, spin in a chair. You can go to an amusement park, get on a roller coaster. You can consume a high amount of caffeine. Like there's lots of ways of creatively inducing body sensations. And you can do those things in an elevator. You can do them on a tram. You can do them on a bus and an airplane. It's about recreating the ideal context that in theory will help the person to become convinced that they don't need to be afraid of the experience.
Yeah. You're probably going to be able to correct something that I did, and I'm sort of exposing perhaps what was not a moment where I felt, super adequate and effective. But I had a client who had, I knew it was panic disorder, and it was specifically a fear of, what was it? I think it was heights. So there's this, not fear of heights, but like it was long distances or something like that. I remember this sort of, and this is years and years ago, but it was this sort of perception of if there was a far distance that would trigger some kind of bodily experience, and then he became fearful of that. So,
okay.
And I struggled. I was thinking about like, do I get him to look out of a window? Because I had all that training, and I remember going, okay, I need to expose him, and maybe I'm not doing a great job of recalling the exact details, but it was something about long distances or far distances. And so, is that something that you've come across? Something comparable?
No. Do you just mean a situation where there's like no objects in the foreground obstructing his view of something very, very far away, like where he can just see very far?
I remember something to do with like angles or distance or height, but it wasn't the classic height, as in like if you're high on a building. But
okay.
It was,
so he wasn't afraid of falling.
No.
If you had someone who's afraid of heights, you could be like, here, go here, stay here. You didn't fall.
Yeah.
But that could be more like one of those types of issues where the underlying concern is this feeling of not just rightness, like tension, discomfort.
Exactly.
Let's imagine the picture behind you is not perfectly square on the wall. And I'm like, I don't like how that makes me feel, this discomfort. And so I have to go straighten it out. I think it's exposure to that feeling.
Okay.
And so I would want to know how you could, what is that feeling? What are the sensations? What are your interpretations about it? Never going away or driving you mad, or you can't handle the intensity or whatever, and then just find ways of trying to recreate that so your client can learn that it's safe and tolerable.
Interesting. Yeah. So really bringing it back to the bodily sensations. And I think that's maybe what it was. I think that perhaps in those moments of panicking, there was something to do with perception of space, which is a common part of a panic attack, is that your sense of space becomes warped. And so maybe he was more describing that, but it was actually because he was in this heightened state. And what you're saying is that relates to his response to his own bodily sort of sensations that were triggered by anxiety.
That would make sense to me.
Yeah. Okay. This is so fascinating. And the thing that I'm sort of really taking from this is when it's excessive anxiety that falls into that pattern of avoidance driving it, which is different from you're in a crappy situation with a job that you hate, or you're being attacked by your mother-in-law in front of others. Like, we are not talking about anxiety relating to those sort of situations, which has a solution and you need to deal with it, and you might need to change jobs or, have a chat with that mother-in-law or whatever it is. There's so much anxiety that I think we don't want to sort of put under the umbrella of it's all avoidance. But what we're talking about is when there is that pattern, and we know a lot about those common patterns, hence why we use words like PTSD or OCD or social anxiety or panic disorder or all those types of things like that, specific phobias. And it really sounds like the key there is about learning And often I imagine you need to do it with someone. So can a lot of that exposure be done solo, or do you, from your experience, is it really something that needs some kind of guidance or coach, aka therapist or psychologist?
Very good question. In theory, it can be done solo.
Yeah.
And there are like guided self-help programs that you can use both in book form and online form. And it's nothing stopping a person from doing their own exposure as long as they're willing. And I think that's the key part. I mean, obviously, the people who did their own exposure and cured themselves never made their way to my office. But the people I see, I think they really benefit from me being there with them throughout the journey. And when people don't benefit from the approach, and not everybody benefits from it, it's usually when they've decided they're just not willing to participate in it. I think it's like going to the gym. If you go to the gym and work out, you'll get more fit. You will, assuming you know what you're doing. Like, it's not like, the gym doesn't work for me. No, you're not going. like that's the essence of exposure, I think.
Yeah, interesting. And so if someone wants help with one of these problems and their therapist says, we need to talk about your childhood, or we need to talk about what happened when you were first developed this problem, because that's quite common, isn't it? Where like they might go, we need to go back to the origins of either your childhood or when this anxiety problem started. What would you say to someone who's been told that?
Well, I would say do your homework before meeting with a therapist. Keep in mind that practically every therapist says they specialize in anxiety. So like that doesn't mean anything.
Right.
Even if your therapist says, I specialize in OCD or PTSD, that still doesn't necessarily mean anything. I would want to know, what do you do for clients with OCD or whatever? And I would want to hear their answer. And I would want it to sound like good exposure therapy and not something different. And I wouldn't sign up with them until I found a person who can say that to me.
Yeah.
And so you might have to do some research. And I think what you want is someone who does exposure, not someone who says, I do anxiety or do cognitive behavioral therapy or do OCD. I want to know that they're going to do exposure.
So basically change therapist. If you go to someone and
it's your life.
In session 2 or 3, they say, look, what we need to do is we need to go back to your childhood and explore the depth and the origins. You would say, find someone who's going to take a different approach and who's going to do exposure with you.
I would react the exact same way I would react if I was unfit and wanted to get more fit and joined a gym and met with a personal trainer who wanted to talk with me about my childhood every session. Because, I mean, it's a waste of time and money and effort when I could be working with someone else who's actually going to help me get fit. I see it exactly the same way.
Get out of there.
Yes.
Change personal trainers.
Well, think about the client I was mentioning with the knife exposure. He saw a psychologist fortnightly for almost a decade. He would have spent more than $50,000. And all of that time and money and effort and lost hope. And when he called me on the phone the first time we talked, he was crying and said, Brett, I don't think I can handle 40 more years of this. And 8 weeks later, gone.
Yeah.
So he didn't need to invest that time.
Yeah.
And he's understandably very angry at that psychologist.
Yeah.
And I am too.
Yeah.
So that's exactly the advice I would give to someone who doesn't want to find themselves having a similar journey.
Yeah. And so just to kind of reiterate what you're saying is, if you've got a clear kind of anxiety, I'm going to use the word disorder or problem or pattern, seek someone, find out someone who does exposure therapy and make sure that they are as much as possible guiding you through that, and not just making little suggestions or throwing out ideas of, hey, you should be a bit more facing it or things like that, but concretely taking them through a sequential steps of exposing themselves to the feared situations or thoughts or sensations.
Yes. And will they do that with you during the sessions?
Yeah.
Because that's essential.
Yeah.
Yes. Yeah. Everything you just said. I agree.
Terrific. Brett, it's been a really insightful discussion. And, you know, what I've really kind of gained from this is an understanding of anxiety. And I mean, obviously some of this, I suppose, is expanding or building on my existing understanding, given I'm a psychologist myself, but this sort of difference between normal, if you can use that word, or appropriate anxiety fitting for a situation versus a pattern that just feeds itself. And usually there it's really about avoidance, and the importance of doing exposure and facing those uncomfortable situations or feelings or thoughts or sensations in order to break that pattern. That's something that's really stood out from today. And changing psychologists if they're not doing that. Is there anything that you want to add, or that you feel like someone out there who's struggling with anxiety would benefit that we haven't touched on, or that you would like to add?
Just one last bigger picture point, which is, I think the reason, if you're struggling with an anxiety issue, the reason to do exposure therapy isn't just to feel less anxious or to overcome the problem. It's to take charge of your life. And for me, the bigger picture is, a life well lived is rich, full, and meaningful in accordance with your values. And exposure therapy can help you do that by learning to be more accepting of the psychological ups and downs that show up along the way. So the reason to do exposure isn't to just overcome your anxiety problem. It's to put yourself on the pathway toward a new lifestyle characterized by willingly approaching valued situations so you can live the life that you want.
Yeah, I love it. And that fits very well with the idea of this show being the self-improvement show, because by facing these fears, by expanding our restricted life, we are improving ourself and therefore our life. So I love it.
Awesome.
Thanks for your time, Brett. It's been always a pleasure to talk to you, and today's no different. And would love to continue perhaps on other topics, maybe another day. But for now, thank you very much for your time today.
Thank you. It's been a pleasure.
Thanks.